So we have our first speaker of the afternoon, Mary Kett, and she's going to speak to us about the report on the wider benefits of learning. Mary, can you take the podium there, please? Thank you.
Thanks, Stan. So, good afternoon, everyone. And my task this afternoon is to give you an update on the ETBI project on the wider benefits of learning. So this is another piece of the jigsaw of the changing landscape that we heard about this morning. So we as adult learning professionals know, of course, anecdotally and through our own experience of the broader multiplicity of benefits that learners gain from engaging in programs. We know this instinctively, but of course the challenge is that to date these so-called wider benefits haven't been categorized or reported on in any systematic way. And this, of course, was raised during the consultation process and the public, once the FET strategy was published, while the strategy acknowledged the important contribution of programs that didn't lead to accredited outcomes in promoting social inclusion, but noted the challenge of capturing the broader benefits that they might offer to learners. So ETBI undertook this project, and simply the aim was to review any frameworks that existed to record wider benefits of learning in the ETB sector, with particular reference to community education and adult literacy programs. Now, those programs were identified not because it was deemed that they were the only programs from which wider benefits might ensue, but because of the high proportion of non-accredited learning that they offer, and because of the administrative challenges involved with very large numbers of learners. So the project involved a brief literature review and consultation with providers about existing initiatives, and then finally a follow-up workshop which has just taken place earlier this month. So in terms of the research findings, in overall terms, this is a relatively new area of research, but there is substantial evidence to show that there are strong associations between adult learning and broader benefits, that is, beyond specific course outcomes. And the literature would pinpoint a range of areas, including those that are listed: health, attitudes and behavior, civic and social engagement, what's termed agency, that is greater independence and self-regulation, and family relationships and intergenerational learning. Now, of course, they're rather artificial. The boundaries between those areas are rather artificial and they overlap. So in overall terms, the research found, both Irish research and research at international level, has demonstrated the positive personal and social impact that adult learning bestows on individuals and communities. And that research also has found contained important findings in relation to specific target groups, as well as information on progression outcomes. So John Field, who would be a distinguished researcher in this area, has summarized in a useful article contained in the AINTHUS academic publication, The Adult Learning, the evidence on balance is persuasive. Now, it's a relatively, in some cases, narrow evidence base that's used to present such evidence, and many of the studies until recently have been qualitative studies. Having said that, often with small groups of learners. Having said that, in more recent times, there have been studies that have involved quite large cohorts. The AINTHUS research on community education, published in 2010, would be one example, and a very large study undertaken by the European Commission, quite recently published, called the BELL study, that's Benefits of Lifelong Learning, actually gathered data with over 8,000 learners in 10 EU countries. So there is substantive evidence there. Having said that, some commentators would report that the qualitative evidence is simply, let's say, a moment in time, and that there is a need to look at more longitudinal data. And some studies actually have undertaken such statistical analysis of existing longitudinal data. And the most useful example of that kind of research in my investigation I found was one that was undertaken or published in just 2012 by the UK Government Department Business Innovation and Skills, which took a fairly severe view of the range of research in relation to wider benefits of learning, but nonetheless concluded, it classified studies in relation to what it thought was the strength of the evidence they provided. But they concluded that both formal and informal learning tend to matter, suggesting participation in learning in itself is important. And they found the greatest impact to be on health, well-being, self-confidence, and job-related outcomes. But they highlighted that the self-confidence, that benefit to learners, was as important as the job-related outcomes in their view. So our study looked at existing initiatives within ETBs, and we conducted a survey to establish how ETBs assess learning outcomes in relation to non-accredited learning. That was particularly with community education and adult literacy. We found all respondents had, of course, established course planning, review, and evaluation systems. But in the responses we received, we highlighted 4 frameworks or tools which had been developed locally to capture wider learning outcomes as well as course-related outcomes. And they were based in Limerick City, in Clare, in the city of Dublin, and in Galway. And now the report that we published contains a detailed review and outline of those frameworks. So I'm obviously not going to go into the detail here, but they're available in the report if you want to look at them. There was a large degree of consistency between them. Now, they all rely on self-assessment by learners through structured exchanges with tutors, using questionnaires, surveys, or scales. And the adult literacy frameworks, there were 3 of those, tend to focus most on developing independence and confidence, which, of course, as you know, are 2 outcomes that are highly referenced in the research literature relating to adult literacy. The community education framework pinpointed a broader range of benefits. In overall terms, the benefits that were highlighted involved personal learning, confidence, health and well-being, family and community, and future education and employment. So our recommendations, we agreed that the existing framework should be piloted in some way in order that to enable data sets relating to these wider outcomes to be compared and analysed. And secondly, and most importantly, we stress the need to create the link with quantitative statistical data relating to fields such as participant profile, socio-economic and education status, and progression. So those data needed to accompany any analysis of these wider benefits, that they shouldn't be reviewed in isolation from that other statistical information. And that thirdly, and again crucially, these data sets or analyses represent what one ETB provider described as a snapshot in time. They're self-assessment tools. They're not external evaluations of programs. And that there would be a need, as recommended in the AINTUS community education research, for broader external evaluations of programs with longitudinal tracking of learners. And we recommended that SOLIS should build on that work that's already been completed by studies like the one undertaken by AINTUS and other UK research into community education. There's a number of very, very interesting reports published by both Business Innovation and Skills and NIACE, which again are detailed in our own report. So to try and push this issue on a little bit further, we organised a workshop with the providers who had contributed these frameworks. And our aim was to try and progress the recommendations by trying to identify and define what the core elements associated with such frameworks should be, and also the practical steps that would be needed to develop a pilot framework. So we did reach agreement on a list of wider outcomes that are most, let's say, the generic ones that seem to occur as an outcome of many programs. And we did also reach agreement on what we felt the key features of these frameworks should be. And we made some recommendations for the next steps. So the broad overarching categories, and we stress that these were overarching categories, not a this shouldn't involve a checklist exercise, were those that are listed there for you. Health and well-being, which occurs frequently, social and civic, most frequently, social and civic engagement, employability was highlighted, learning to learn, and personal development and personal and family relationships. What we felt the key features of such frameworks should involve all of these issues. This is about as I said already, self-assessment by learners, which is mediated by the tutor. It's not an external course evaluation. The frameworks devised have to be useful and meaningful to learners. It's not just about collecting statistical evidence. That they need to be used for planning and reporting locally as well as reporting nationally. They have to be user-friendly to enable buy-in. Systems can't be complex. And the data, as I've said, has to have validity for learners, providers, and funders. And there needs to be agreement about a range of methodologies for the collection of evidence. We need some consistent system for collating the evidence, and to do that, we need to devise some kind of scale or profiling system to to represent the data collected in quantitative form. And those of you who would be familiar with some of these frameworks would understand that is a key requirement, that you can end up with a mass of qualitative reports which make it impossible to report in any succinct way. So we need some kind of scale or profiling system that will allow us to then collate the evidence that's collected. And NIACE have actually developed a tool which we felt could be used to do that. But there needs to be an intermediary step between quantifying the information collected in some way. And that once the data is collected, it needs to be aligned to existing MIS systems, that it can't stand in isolation. So it needs to align to the FAR and the PLSS systems. So finally, just to say again, one of the points of our discussion during the 2-day workshop was about how robust the data collected could be deemed to be. And we stressed again that it's about providing a snapshot in time about information from provision that's aligned to other quantitative data, but there would be a need for ongoing broader evaluations of provision. So finally, we agreed it would be feasible, based on the information and the key features that we agreed, to develop a so-called prototype framework that could be then piloted and reviewed once providers received some training. And as you may be aware, existing frameworks have already been, by word of mouth and through your own professional organisations, they're being piloted in a number of ETBs. So just finally, to conclude on that point, hopefully the project can be progressed, and to, I suppose it's in order to thank ETBI for undertaking this project, and finally also to thank all the providers who sent information, provided examples, and provided me with feedback and support during the project. Thanks again.